With this, a very warm good afternoon to each and everyone present here today online. It's a great matter and honor and privilege to welcome you all to the valedictory ceremony of the value-added course on primary care volunteers for psychiatric services. We have successfully completed batch 2 and the special session on the mental health issues in road rage and road traffic accident. So in this occasion, let me take this opportunity to welcome the guests today. So we welcome with a great respect Shri K. Parashurama sir, IPS, our chief guest for this afternoon. So he serves as a Deputy Inspector General of Police and Commissioner, the Traffic and Road Safety, Government of Karnataka. His dedication to public safety and road discipline makes his presence today especially meaningful for a program on the mental health in a road rage and road traffic accidents. Sir, we extend a very warm welcome to you to this program, sir. On behalf of the Department of Psychiatry, JSS Medical College and JSS Academy of Higher Education and Research. We welcome you to this program, sir. So let me take this opportunity to welcome Dr. H. Basavanagadappa, sir, Vice Chancellor, JSS AHER, Mysuru. Your leadership and commitment to the academic excellence are an inspiration to all of us, sir. A very warm welcome to you, sir. Further, I also take this opportunity to welcome Dr. B. Manjunatha, sir, Registrar, JSS AHER, Mysuru. So we are grateful for your continued support and guidance. We welcome you to this program, sir.
Thank you, Pradeep.
Thank you, sir. Let me take this opportunity to welcome Dr. Madhu CP, sir, the Director, JSS Hospital, Mysuru. We thank you for your presence and your unwavering commitment to the healthcare, and we welcome you to this program, sir. So further, let me take this. It's my privilege to welcome Dr. Narayanappa D, sir, Principal, JSS Medical College, Mysuru. Your presence adds a great value for today's function. We welcome you to this program, sir. In addition to it, Dr. Suma, Madam, Vice Principal, Pre and Paraclinical, JSS Medical College. We welcome you to this program, ma'am.
Thank you.
And Dr. Mantappa, sir, Vice Principal, Clinical, JSS Medical College and Hospital. We welcome you, sir. This sir is not there, I guess. In his absence, I welcome you, sir. And it is most important, Dr. Kishore M., the Professor and the Head, Department of Psychiatry, JSS Medical College and Hospital. We are grateful for your vision and leadership in organizing this important course, sir, and organizing this event also. We welcome you to this program, sir. Along with this, we also warmly welcome all the faculty members and special speakers and the participants and everyone joining us through the Zoom today. And a special welcome to the participants who have successfully completed this value-added course on primary care volunteers for psychiatric services, batch 2. I welcome again one and everyone. The next, it's a time to, I request, we shall now have a privilege of hearing from the esteemed guest. So now I request Dr. Kishore Hep, Professor and Department of Psychiatry, to deliver opening remarks.
With the blessings of His Holiness, it's a privilege to be part of this program. With respects to the Vice Chancellor, Registrar, Principal, Director of the JSS Hospital, Vice Principal, and most importantly, DIG and Police Commissioner Parashurama. He is in this HP mode and he's trying to re-log in. And he has joined again. We wanted to thank him. Despite his busy schedule, he thought about this particular program because we wanted to empower public. Parashuram sir, welcome back to this program. I hope it is audible and clear to you now. And it's indeed a privilege that you thought of joining this program virtually. We were waiting to meet you in person. This is the India's first program by any medical college to empower public in mental health. And now we are collaborating with NIMHANS to start in Kannada. That is the importance we have given to this particular program. Our Holiness and our Vice Chancellor, our Registrar, Principal, Director, all have supported so that we can connect to the public. And since you suggested that we should also play an equal role in the empowerment of police department, in your tenure as SP in Mandya district, we were happy that we all were there together to empower the all police force in the Mandya district. Now that you are the DIG of traffic and traffic in the government of Karnataka, and one of the most important issues is road traffic accidents secondary to use of alcohol and other substances, and also emerging issues with road rage and deaths thereof. We want this program to be unique, that it caters to all these things. With this, I am really thankful to you and presence of all the leadership and others who thought of joining to this program. Over to you, Pradeep.
Thank you, sir. Thank you so much for the opening remarks. Now I invite Dr. B. Manjunatha, sir, Registrar JSS CHR, to share a few words with us.
Hello, am I audible?
Yes, sir. Yes, sir. You're audible, sir.
I thank Parashurama sir for the I thank Parashurama sir for taking this initiative and the Department of Psychiatry. It is an excellent concept, and the theme also is very with need based today because of the road rage and road traffic accidents. As a forensic medicine expert, I know the maximum cases we face is road traffic accidents which come to the mortuary, and most of them will be preventable. So this initiative will be very good, and I also congratulate this second batch of students of participants for this course, and wish them all the very best. I think we are eager to listen to the talks. Thank you.
Thank you, sir. Thank you so much for your visionary guidance and words of encouragement. Now, let me invite Dr. Madhu CP, sir, Director JSS Hospital, to share a few words with us. Madhu, sir?
I think, sir, as this communication, we can go to principal, sir.
Okay. So let me take this opportunity to invite Dr. Narayanappa D, sir, Principal JSS Medical College. Sir, I request you to share your insights.
Good evening, everybody. Seeking the blessings of His Holiness Swamiji, I congratulate the Department of Psychiatry headed by Dr. Kishore, who has successfully completed the primary psychiatric care provider course, second batch being successfully completed. And I welcome Sri Parashurama sir, who is aptly, as our registrar was telling, the team is rightly suiting the title traffic range and road traffic accident. Whenever there is an accident, we focus on the injuries. What has happened to head, spine injury, body injury, visceral injury, things like that. But we will forget the most important injury that is invisible. That is psychological injury, which we will not detect. Even as a medical person, one should remember it is the psychological injuries, it's the psychiatric crisis that has caused the disease. And we must know, look at when we enter a casualty, when there is a mass accident, the people will be suffering a lot of injuries. Look at the attenders, look at the patient, look at the person who has created injuries. So nowadays it has become driving has become a major psychiatric illness. Now safety, road safety reflects the mental status of an individual. If a driver, anybody for that matter, is stressed out, has got underlying psychological problems like anxiety, depression, behavioral issues, they are prone for accidents. The burned out in their daily work, the stress, all these factors will precipitate injuries, and they also cause road rage. So also the after injury, after traffic accident, that also will lead on to post-traumatic psychological illness, both in the patient and in the attenders also. So it is very, very important that we have to look at the invisible illness, that is the psychiatric illness behind a road traffic accident. So I really congratulate the team for starting a wonderful program, especially giving primary psychiatric care by the public, and Also, the title for today's is aptly suited, and over to you. Will be listening to you. Thank you very much.
Thank you, sir. Thank you, sir, for your valuable thoughts. Now I request Madhu CP, sir, Director, JSS Hospital, to share a few words and address the gatherings.
Good afternoon, all. I welcome all of you once again. And first of all, I would like to congratulate the Department of Psychiatry who has taken the initiative in organizing such a useful program. And we welcome our chief guest and speaker also to this function. And as all of us know, the very important cause of death, preventable deaths, is the road traffic accidents. And also, I was told that in 2025, only in Karnataka, there is a very significant number of road traffic accidents have happened. And nearly about 8,000 to 9,000 people have lost their lives. And so much so, a lot of people have been left injured. And in this probably context, I would like to mention that, of course, the alcohol use probably has a direct bearing on this deaths. And another important reason is the road rage. I think on these two topics, I think probably the sir is here, Mr. Parashurama, to highlight about this. And it's a few value-added courses which have been probably started by the Department of Psychiatry, probably will have a significant role in creating the public awareness and prevent these road traffic accidents and also road rage. And thank you very much, Dr. Kishore. And without wasting much time, probably we'll start on with your programs. Thank you very much for inviting me. And this is a few words that I can say about this particular topic. Thank you.
Thank you, sir. Thank you, sir, for inspiring words. So, and now we arrive at the most distinguished segment of today's program. It's a chief guest.
Suma madam.
Sir?
Suma madam is there. Suma
I'm so
madam.
sorry. I'm so sorry. Suma ma'am, I'm so sorry.
Yeah, it's okay. No issues.
Yeah, ma'am, I request you to address the gathering, ma'am.
Very good afternoon to all. Let me first congratulate the Department of Psychiatry, led by Kishore and team, for organizing this value-added program, which is need of the hour. Mental health in road rage, road traffic accidents, and substance use. And every day we keep reading in the newspaper that many accidents are happening, and they never think of their family. And as told by our principal and Madhu sir, this mental health issues, which is very much required, awareness about all these things is very much required. I think all the participants will have taken it very positively. And I think one more request is, after obtaining the feedback from the participants, if this can be published, so that it will come to the notice of most of the people then. I think this initiative can be taken by the department. And thank you, Parashurama sir, for coming here and addressing all of us. Thank you very much, sir. I know how difficult it is, your task in handling these traffic accidents and other things. So thank you very much, sir, for all the support. Thank you.
Thank you, madam. Thank you, madam, for the nice words. So now we arrive at the most distinguished segment of today's program. It's a chief guest talk. It's my immense honor and privilege to invite our chief guest, Dr. K. Parashurama, IPS, Deputy Inspector General of Police and Commissioner, Traffic and Road Safety, Government of Karnataka, to deliver the chief guest talk. Sir, over to you, sir.
Thank you, sir. Am I audible?
Yes, sir.
Yes, sir, you're audible, sir.
Thank you, sir. Respected principal, sir. All the dignitaries on the platform, and Kishore, sir, and my beloved Sandeep, who is well-being officer in our department. Thanks for inviting me to the session. Thank you, sir. Sincere apologies to you. Can I speak in Kannada, which is fluent to me?
Okay, sir. Okay, sir. We'll be very happy. In fact, he is translating now to Kannada, our Kishore, whole program.
And we are starting Kannada course also, sir. ಅದರಿಂದ ನೀವು ಆರಾಮಾಗಿ ಕನ್ನಡದಲ್ಲಿ ಮಾತಾಡಬಹುದು.
Yes, sir. Yes, sir. Thank you, sir. Thank you so much. And first of all, I like to congratulate Dr. Kishore, sir, to bringing this issue on board actually. ತುಂಬಾ ಸರಿ ನಾವು ಆಕ್ಸಿಡೆಂಟ್ ಆಗ್ತವೆ ಸರ್, ಪ್ರಿನ್ಸಿಪಲ್ ಸರ್ ಹೇಳಿದಾಗೆ ನಾವು ಬೇರೆ ಬೇರೆ ಆಸ್ಪೆಕ್ಟ್ ಅನ್ನು ನೋಡ್ತೀವಿ. ಆಕ್ಚುಲಿ ನಿಜವಾಗಿಯೂ ವಾಟ್ ಇಸ್ ದ ಸೈನ್ಸ್ ಬಿಹೈಂಡ್ ಆಕ್ಸಿಡೆಂಟ್ ಅನ್ನೋದನ್ನ ನಾವು ಯಾರು ಯೋಚನೆ ಮಾಡಲ್ಲ. ಐ ಥಿಂಕ್ ಪೋಸ್ಟ್ ಆಕ್ಸಿಡೆಂಟ್ ಇಶ್ಯೂಸ್ ಏನಿದೆ ಅದರ ಕಡೆಗೆ ನಾವು ಗಮನ ಹರಿಸ್ತಾ ಇದ್ದೀವಿ. ಆದ್ರೆ ಹಿಂದೆ ಇರುವಂತ ಒತ್ತಡಗಳೇನಿದಾವೆ ಅಥವಾ ರೀಸನ್ಸ್ ಏನಿದೆ ಅದನ್ನ ಪತ್ತೆ ಮಾಡೋದಕ್ಕೆ ತಾವು ಪ್ರಯತ್ನ ಮಾಡ್ತಾ ಇದ್ರಿ. ಮೊದಲನೇದಾಗಿ ತಮಗೆ ತುಂಬ ಹೃದಯದ ಧನ್ಯವಾದಗಳನ್ನು ತಿಳಿಸ್ತೇನೆ. ಸ್ಪೆಷಲಿ ಆಕ್ಸಿಡೆಂಟ್ ಅಂತ ಬಂದ ತಕ್ಷಣ ಅಥವಾ ರೋಡ್ ಟ್ರಾಫಿಕ್ ಆಕ್ಸಿಡೆಂಟ್ ಏನಿದೆ ಇದು ಮಲ್ಟಿ ಸ್ಟೇಕ್ ಹೋಲ್ಡರ್ಸ್ ಇರುವಂತ ಕೆಲಸ. ಇದು ಜನರಲಿ ಡೈರೆಕ್ಟ್ ಆಗಿ ಪೊಲೀಸರು, ಡಾಕ್ಟರ್ಸು ಎಲ್ಲರೂ ಇನ್ವಾಲ್ವ್ ಆಗ್ತಾರೆ. ಅದ್ರ ಹಿಂದೆ ತುಂಬಾ ಜನರ ಕೊಡುಗೆ ಇದೆ, ಪ್ರಯತ್ನ ಇದೆ, ಎಫರ್ಟ್ ಇದೆ. ಎಲ್ಲರೂ ಕೂಡ ಪ್ರಾಮಾಣಿಕವಾಗಿ ಪ್ರಯತ್ನ ಮಾಡ್ತಾ ಇದ್ದಾರೆ. ಜನರಲಿ ಇಟ್ ಈಸ್ ಎಜುಕೇಶನ್, ಇಂಜಿನಿಯರಿಂಗ್, ಎನ್ಫೋರ್ಸ್ಮೆಂಟ್, ಎಮರ್ಜೆನ್ಸಿ ಕೇರ್ ಅಂಡ್ ಇಂಪ್ಲಿಮೆಂಟೇಶನ್ ಇದೆಲ್ಲವೂ ಕೂಡ ಇದ್ರೊಳಗೆ ಬಂದ್ಬಿಡುತ್ತೆ. ಪ್ರತಿ ವರ್ಷ ನಾವು ಆಕ್ಚುಲಿ ಒಂದೊಂದು ವರ್ಲ್ಡ್ ವಾರ್ ಅನ್ನ ನೋಡ್ತಾ ಇದ್ದೀವಿ. ಪ್ರತಿ ವರ್ಷ ವರ್ಲ್ಡ್ ಅಲ್ಲಿ 1.3 ಮಿಲಿಯನ್ ಜನ ರೋಡ್ ಟ್ರಾಫಿಕ್ ಆಕ್ಸಿಡೆಂಟ್ ಇಂದ ಸಾಯ್ತಾ ಇದ್ದಾರೆ. ಇಂಡಿಯನ್ ಸಿನಾರಿಯೋ ಬಂದ್ರೆ 1.5 ಲ್ಯಾಕ್ ಗಿಂತ ಜಾಸ್ತಿ ಸಾಯ್ತಾರೆ. ಕರ್ನಾಟಕದಲ್ಲಿ ಪ್ರತಿ ವರ್ಷ 11 ರಿಂದ 12 ಸಾವಿರ ಪ್ರತಿ ವರ್ಷ ರಸ್ತೆ ಮೇಲೆ ಅನಾಥವಾಗಿ ಜೀವ ಚೆಲ್ತಾ ಇದ್ದಾರೆ. ಮೇ ಬಿ ಪ್ರತಿಯೊಂದು ಸಾವು ಕೂಡ ಅದ್ರ ಹಿಂದೆ ಅವರ ಲವ್ಡ್ ಒನ್ಸ್ ಇರ್ಬೋದು, ಅವರ ಎಮೋಷನ್ಸ್ ಇರ್ಬೋದು, ಅವರ ಫ್ಯಾಮಿಲಿ ಎಕನಾಮಿಕ್ ಕಂಡೀಷನ್ಸ್ ಎಲ್ಲವೂ ಕೂಡ ಅದರೊಳಗಿದೆ. ಮೇ ಬಿ ನಾವು ಪೊಲೀಸ್ ಆಫೀಸರ್ಸ್ ಆಗಿ ನಮಗೊಂದು ಕ್ರೈಮ್ ನಂಬರ್ ಆಫ್ ಡೆತ್ಸ್ ಅಷ್ಟೇ. ಆಸ್ ಅ ಡಾಕ್ಟರ್ ಆಗಿ ತಮಗೊಂದು PM ಅಷ್ಟೇ ಇರ್ಬೋದು ಅಥವಾ ಒಂದು ಟ್ರೀಟ್ಮೆಂಟ್ ಅಷ್ಟೇ ಇರ್ಬೋದು. ಪ್ರತಿಯೊಬ್ಬರಿಗೂ ಐ ಥಿಂಕ್ ಆಸ್ ಅ ಪ್ರೊಫೆಷನಲ್ಸ್ ನಾವು ಆ ಥರ ಯೋಚನೆ ಮಾಡಿದಾಗ ಅನ್ಸುತ್ತೆ. ಬೀಯಿಂಗ್ ಅಗ್ರೀವ್ಡ್ ಫ್ಯಾಮಿಲಿ ಮೆಂಬರ್ಸ್ ಆಗಿ ಯೋಚನೆ ಮಾಡಿದ್ರೆ ಅದನ್ನ ನಾವು ಯಾರು ಕಲ್ಪನೆ ಮಾಡ್ಕೊಳಕ್ಕಾಗಲ್ಲ. ಅದು ಇಮ್ಯಾಜಿನೇಷನ್ಗೆ ಸಿಗದೆ ಇರೋಂಥ ಡಿಸ್ಟ್ರೆಸ್ ಅದು. ಬಹುಶಃ ರೋಡ್ ರೇಜ್ ಮತ್ತೆ ರೋಡ್ ಆಕ್ಸಿಡೆಂಟ್ ಜನರಲಿ ಕಾಣುವಂಥದ್ದು ಸಿಟಿಗಳಲ್ಲಿ ಮತ್ತೆ ನ್ಯಾಷನಲ್ ಹೈವೇದಲ್ಲಿ. ಎಲ್ಲರೂ ಕೂಡ ಒಂದು ಹರಿಲೇ ಇರ್ತಾರೆ. ಯಾರು ಕೂಡ ಮನೆ ಬಿಟ್ಟಾಗ ಜನರಲಿ ಬಹಳ ಸುಲಭವಾಗಿ ನಾವು ಹೇಳ್ತೀವಿ, ಬೇಗ ಮನೆ ಬಿಡಿ, ನಿಧಾನಕ್ಕೆ ಆಫೀಸ್ ಸೇರ್ಕೊಳ್ಳಿ ಅಥವಾ ನಿಮ್ಮ ಡೆಸ್ಟಿನೇಷನ್ ಸೇರ್ಕೊಳ್ಳಿ ಅಂತೇಳಿ, ವಿಚ್ ಇಸ್ ನಾಟ್ ಇಂಪಾಸಿಬಲ್ ಆಕ್ಚುಲಿ ಪ್ರಾಕ್ಟಿಕಲಿ. ನಾವು ಕೂಡ ಆಫೀಸಿಗೆ ಬಿಡುವಾಗ ಲೇಟಾಗಿ ಬಿಡ್ತೇವೆ, ಹರಿಲೇ ಬರ್ತೇವೆ. ಪ್ರತಿಯೊಬ್ಬರು ಕೂಡ ಅದೇ ತರನೇ. ಅಂಡ್ ಈ ಇಂಬ್ಯಾಲೆನ್ಸ್ ಏನಿದೆ ಇದನ್ನ ನಾವು ಬ್ಯಾಲೆನ್ಸ್ ಮಾಡೋದಕ್ಕೆ ಹೋದಾಗ ನಿಜವಾಗಿಯೂ ಆಕ್ಸಿಡೆಂಟ್. ಈ ಆಕ್ಸಿಡೆಂಟ್ಗೆ ಮೇ ಬಿ ಬಹಳ ವರ್ಸ್ಟ್ ಥಿಂಗ್ ಏನು ಅಂತಂದ್ರೆ, ನಾನು ಸರಿ ಇರಬಹುದು ಆದ್ರೆ ಆಪೋಸಿಟ್ ಬರೋನು ಸರಿ ಇರ್ಬೇಕು. ಇಟ್ ಈಸ್ ನಾಟ್ ಓನ್ಲಿ ಸೋನ್ಲಿ ಡಿಪೆಂಡೆಂಟ್ ಆನ್ ಮೀ, ಇಟ್ ಈಸ್ ಡಿಪೆಂಡೆಂಟ್ ಅಪಾನ್ ಆಪೋಸಿಟ್ ಸೈಡ್ ಈಸ್ ಕಮಿಂಗ್ ಟುವರ್ಡ್ಸ್ ಮೀ ಆಲ್ಸೋ. ಆರ್ ಯಾರು ನನ್ನ ಜೊತೆಗೆ ಪ್ರಯಾಣ ಮಾಡ್ತಾ ಇದ್ದಾನೆ ಅಥವಾ ನನ್ನ ಅಕ್ಕಪಕ್ಕ ಯಾರು ಬರ್ತಾ ಇದ್ದಾನೆ ಅವನು ಕೂಡ ಇದರಲ್ಲಿ ಬಹಳ ಇಂಪಾರ್ಟೆಂಟ್ ರೋಲ್ ಅನ್ನು ಪ್ಲೇ ಮಾಡ್ತಾನೆ. ಹಂಗಾಗಿ ಆಕ್ಸಿಡೆಂಟ್ ಅನ್ನ ನಾವು ಯಾರ ಮೇಲೂ ಬ್ಲೇಮ್ ಮಾಡೋಕ್ಕಾಗಲ್ಲ. ಅದೇ ಕಾರಣಕ್ಕಾಗಿ ಇದರಲ್ಲಿ ಟೇಕ್ ಎ ಕಾಲ್, ಜಸ್ಟ್ ಎ ಮಿನಿಟ್ ಪ್ಲೀಸ್.
Done.
ಸಾರಿ ಫಾರ್ ಇನ್ಕನ್ವೀನಿಯನ್ಸ್, ಸಾರಿ. ಜನರಲಿ ಈ ಕಾರಣಕ್ಕಾಗಿನೇ ನಮಗೆ ಆಕ್ಸಿಡೆಂಟ್ಗಳು ಆಗ್ತಕ್ಕಂಥದ್ದು ತುಂಬಾ ಸಾರಿ ನಾವು ಗಮನಿಸ್ತಾ ಇರ್ತೇವೆ. ಬಹಳ ಮುಖ್ಯವಾಗಿ ಪ್ರತಿಯೊಬ್ಬನಿಗೂ ಕೂಡ ಐ ಥಿಂಕ್ ಸೈಕಾಲಜಿಕಲಿ ಮಾತಾಡ್ಬೇಕು ಅನ್ನೋದ್ರೆ ಆಸ್ ಎ ಲೇ ಮ್ಯಾನ್ ಪ್ರತಿಯೊಬ್ಬನಿಗೂ ಕೂಡ ಒಂದು ಇಗೋ ಇದೆ. ಐ ಥಿಂಕ್ ಹಿ ಮೇ ಬಿ ದ ಕಂಪನಿ MD, ಹಿ ಮೇ ಬಿ ದ ಟಾಪ್ ಎಂಟರ್ಪ್ರಿನರ್, ಹಿ ಮೇ ಬಿ ದ ಪ್ರೊಫೆಸರ್, ವಾಟ್ ಎವರ್, ಯಾರೇ ಇರಬಹುದು, ಅವರಿಗೆ ಅವ್ರದ್ದೇ ಆದ ಇಗೋ ಇರುತ್ತೆ ರೋಡಿಗೆ ಬಂದಾಗ. ಅಂಡ್ ಅಟ್ ದ ಸೇಮ್ ಟೈಮ್ ಹಿ ಮೇ ಬಿ ಆನ್ ಪಬ್ಲಿಕ್ ರೋಡ್ ಬಟ್ ಹಿ ಸಿಟ್ಸ್ ಇನ್ ಹಿಸ್ ಓನ್ ವೆಹಿಕಲ್ ವಿಚ್ ಇಸ್ ಬಿಲಾಂಗ್ಸ್ ಟು ಹಿಮ್. ಜನರಲಿ ಅದು ಒಂಥರ ಅವ್ರದ್ದೇ ಆದ ಒಂದು ಕಂಫರ್ಟ್ ಇರುತ್ತೆ. ಆಪೋಸಿಟ್ ಬರುವಂತವನು ಜನರ ಸ್ವಲ್ಪ ಮೇ ಬಿ ಬಹಳಷ್ಟು ರೋಡ್ ರೇಜ್ಗಳನ್ನ ಈ ಇಗೋವನ್ನ ದಾಟಿ ಮಾತಾಡೋದಾದ್ರೆ ಸಿಂಪಲ್ ಸಾರಿ, ನೆಕ್ಸ್ಟ್ ಟೈಮ್ ಈ ತರ ಆಗಲ್ಲ, ಒಂದು ವರ್ಡ್ ಮೇ ಬಿ ಅದನ್ನ ಸಾಲ್ವ್ ಮಾಡಿಬಿಡಬಹುದು. ಆದ್ರೆ ನಾನ್ಯಾಕೆ ಸಾರಿ ಕೇಳಬೇಕು ಅಥವಾ ನಂದು ತಪ್ಪಿಲ್ಲ ಅನ್ನೋ ಭಾವನೆ ಇದೆಯಲ್ಲ, ಅದು ಅದನ್ನ ಫರ್ದರ್ ಎಕ್ಸ್ಟೆಂಡ್ ಮಾಡುತ್ತೆ. ಇಬ್ರು ಕೂಡ ಅಗ್ರೆಷನ್ಗೆ ಹೋಗ್ತಾರೆ. ತುಂಬಾ ಸಾರಿ ಅಪ್ ಟು 307 ಅಟೆಂಪ್ಟ್ ಮರ್ಡರ್ ಕೇಸ್ ಆಗೋವರೆಗೂ ಕೂಡ ಇದು ಹೋಗಿರೋದನ್ನ ನಾವು ಗಮನಿಸಿದೀವಿ. ಅಂಡ್ ಬೆಂಗಳೂರು ಈಸ್ ಡಿಫರೆಂಟ್ ಕೈಂಡ್ ಆಫ್ ರೋಡ್ ರೇಜ್ ಥಿಂಗ್ಸ್. ಆಕ್ಚುಲಿ ಈ ರೋಡ್ ರೇಜ್ಗೆ ಇಲ್ಲಿ ಬೆಂಗಳೂರಲ್ಲಿ ರೀಸನ್ ಆಗ್ತಕ್ಕಂಥದ್ದು ಅದು ಭಾಷೆ ಆಗ್ಬೋದು, ನಾರ್ತ್ ಸೌತ್ ಅನ್ನುವಂತ ಪೋಲರೈಸೇಷನ್ ಆಗ್ಬೋದು, ಇದು ಕೂಡ ರೀಸನ್ ಆಗ್ಬಿಡುತ್ತೆ. ತುಂಬಾ ಸಾರಿ ಸೋಷಿಯಲ್ ಮೀಡಿಯಾದಲ್ಲಿ ನಾವು ಅದನ್ನ ತುಂಬಾ ಸಾರಿ ಗಮನಿಸ್ತೀವಿ. ಅಂಡ್ ವಿಕ್ಟಿಮ್ ಕಾರ್ಡ್ ಅನ್ನ ಯೂಸ್ ಮಾಡೋದಕ್ಕೆ ಈ ನಾರ್ತ್ ಸೌತ್ ಭಾಷೆ ಇವೆಲ್ಲವೂ ಕೂಡ ವಿಕ್ಟಿಮ್ ಕಾರ್ಡ್ಗಳಾಗಿಯೂ ಕೂಡ ಬಳಕೆ ಆಗುತ್ತೆ. ಇದು ನಿಜವಾಗಿಯೂ ಶುರುವಾಗುವಂಥದ್ದು ಈ ಸಣ್ಣ ಇಗೋದಿಂದಲೇ ಸ್ಟಾರ್ಟ್ ಆಗುತ್ತೆ. ಆ ಇಗೋನ ಬೇಕಿದ್ರೆ ನಾವು ಯಾವ ರೀತಿ ಬೇಕಾದ್ರೂ ಕರ್ಕೊಳ್ಬಹುದು. ಬಹುಶಃ ಯಾರ ಸ್ಪೇಸ್ ಅನ್ನ ಯಾರು ಕೂಡ ಕ್ರಾಸ್ ಮಾಡಬಾರ್ದು ಅಂತಕ್ಕಂತ ಮನೋಭಾವನೆ ಇದಕ್ಕೆ ಕಾರಣ ಇರ್ಬೋದು. ಮತ್ತು ಕಿಶೋರ್ ಸರ್ ಅಂಡ್ ಅದರ್ಸ್ ಮೇ ಬಿ ಎಕ್ಸ್ಪ್ಲೈನ್ ಇನ್ ಬೆಟರ್ ವೇ. ಐ ಥಿಂಕ್ ಬಹಳ ಕಷ್ಟ ಅದನ್ನ ಹೇಳೋದು. ಮೇ ಬಿ ಅದೊಂದು ರೀಸನ್ ಇರ್ಬೋದು ಅಂತೇಳಿ ಆಸ್ ಎ ಲೇ ಮ್ಯಾನ್ ನಾನು ಆತರ ಅನ್ಕೊಳ್ಳೋದಕ್ಕೆ ಇಷ್ಟಪಡ್ತೀನಿ. ಅದ್ರ ಜೊತೆಗೆ ಒಂದು ಐಡೆಂಟಿಟಿ ಕ್ರೈಸಿಸ್ ಕೂಡ ಪ್ರತಿಯೊಬ್ಬರಿಗೂ ಕೂಡ ಇರುತ್ತೆ. ಮೇ ಬಿ ಅವರು ಯಾವುದೇ ಕೆಲಸ ಮಾಡ್ಲಿ, ಎಂಥದ್ದೇ ಇರಲಿ, ಅವ್ರದ್ದೇ ಆದ ಒಂದು ಐಡೆಂಟಿಟಿನ ಸಮಾಜದಲ್ಲಿ ಅವರು ಎಸ್ಟಾಬ್ಲಿಷ್ ಮಾಡ್ಕೊಂಡಿರ್ತಾರೆ. ಮೇ ಬಿ ಅವರು ಅವ್ರ ಕಿಡ್ಸ್ ಜೊತೆಗಿರ್ಬೋದು, ಫ್ಯಾಮಿಲಿ ಜೊತೆಗಿರ್ಬೋದು, ಫ್ರೆಂಡ್ಸ್ ಜೊತೆಗಿರ್ಬೋದು. ಆ ಸಂದರ್ಭದಲ್ಲಿ ಯಾರಾದ್ರೂ ಒಬ್ಬ ಸ್ವಲ್ಪ ಹರ್ಟ್ ಆಗೋ ತರ ಮಾತಾಡಿದ್ರೆ ಡೆಫಿನೆಟ್ಲಿ ಅವರು ಅಗ್ರವೇಟ್ ಆಗೋದಕ್ಕೆ ಸಾಕಷ್ಟು ಅವಕಾಶಗಳಿರ್ತವೆ. ಈ ಕಾರಣಕ್ಕಾಗಿಯೂ ಕೂಡ ರಸ್ತೆ ಅಪಘಾತಗಳಿಗೆ, ರೋಡ್ ರೇಜ್ಗೆ ಮುಖ್ಯವಾಗಿ ಒಂದು ಕಾರಣ ಇದೆ, ಇನ್ನೊಂದು ಕಾರಣ ಇತ್ತು. ಅದ್ರ ಜೊತೆಗೆ ಇದೊಂಥರ ಈ ತುಂಬಾ ಸಾರಿ ನಾವು ನ್ಯಾಷನಲ್ ಹೈವೇಗಳಲ್ಲಿ ಡ್ರೈವರ್ಗಳನ್ನ ಗಮನಿಸ್ತೀವಿ. ಅವರ ಬಿಹೇವಿಯರ್ ಡಿಫರೆಂಟ್ ಆಗಿರುತ್ತೆ. ಅವರು ಯಾವುದೋ ಲೋಕದಲ್ಲಿ ಇರ್ತಾರೆ ಅಂಡ್ ಅವರ ಒಟ್ಟು ಬದುಕಿನ ಶೈಲಿನೇ ಬೇರೆ ತರ. ಆಲ್ಮೋಸ್ಟ್ ಮೆಜಾರಿಟಿ ಆಫ್ ದರ್ ಲೈಫ್ ಆನ್ ರೋಡ್ಸ್ ಹೋಗ್ಬಿಡುತ್ತೆ. ಪಾಪ ಯಾವುದೋ ಡಾಬಾದಲ್ಲಿ ಮಲಗ್ತಾರೆ, ಎಲ್ಲೋ ಜಾಗ ಸಿಕ್ಕಲ್ಲಿ ಸ್ನಾನ ಮಾಡ್ತಾರೆ, ಇಲ್ಲ ಅಂದ್ರೆ ಅದಿಲ್ಲ. ಅಂಡ್ ಅವರ ರೀತಿ ನೀತಿಗಳೇ ಬೇರೆ ತರ ಇರ್ತವೆ. ಅಂಡ್ ಈಗಂತೂ ಕೂಡ ಏನಾಗ್ಬಿಟ್ಟಿದೆ ಅಂತಂದ್ರೆ ಅವ್ರ ಕೈಲಿ ದುಡ್ಡು ಕೂಡ ಇರೋದು. ಮೇ ಬಿ ಅವರ ಖರ್ಚಿಗೆ ಅಥವಾ ದಾರಿ ಖರ್ಚಿಗೆ ಸಾಕಾಗುವಷ್ಟು ಅಮೌಂಟ್ ಅನ್ನ ಅವರ ಓನರು ಅಥವಾ ಟ್ರಾವೆಲ್ ಏಜೆನ್ಸಿಯವರು ಕೊಟ್ಟು ಕಳಿಸ್ತಾರೆ. ಮಿಡ್ಲಲ್ಲಿ ದೇ ಆರ್ ಆಲ್ಸೋ ಹ್ಯೂಮನ್ಸ್. ಮೇ ಬಿ ಅವರು ಸಾಕಷ್ಟು ಟ್ರಾಫಿಕ್ ವೈಲೇಷನ್ಸ್ ಅನ್ನ ಮಾಡ್ತಾರೆ. ಅಂಡ್ ಈಗ ನಾವು ಮೊದ್ಲಿನ ತರ ಇಲ್ಲ, ಇಲಾಖೆ ಕೂಡ ಸಾಕಷ್ಟು ಪರಿವರ್ತನೆ ಆಗಿದೆ. ಸಾಕಷ್ಟು ಟೆಕ್ನಾಲಜಿ ಇಂಟರ್ವೆನ್ಷನ್ ಕೂಡ ನಮ್ಮ ಟ್ರಾಫಿಕ್ ಎನ್ಫೋರ್ಸ್ಮೆಂಟ್ ಅಲ್ಲಿ ಬಂದ್ಬಿಟ್ಟಿದೆ. ಹೈವೇ ಮೇಲೆಲ್ಲ ಕ್ಯಾಮ್ರಾಗಳನ್ನ ಹಾಕಿದೀವಿ. ಐ ಥಿಂಕ್ ಒಂದು ವೈಲೇಷನ್ ಆಗ್ತಿರೋ ಹಾಗೆ ನಿಮ್ಮ ಮೊಬೈಲ್ಗೆ SMS ಬರುತ್ತೆ, ಇಂಥ ವೈಲೇಷನ್ ಆಗಿದೆ ಅಂತ ಹೇಳಿ. ಮೇ ಬಿ ಇಫ್ ಇಟ್ ಈಸ್ ವಿಸಿಬಲ್ ವೈಲೆನ್ಸ್, ಮೇ ಬಿ ಯಾರಾದ್ರೂ ಪೊಲೀಸರು ಅಡ್ಡ ಹಾಕ್ಬೋದು. ಅಂಡ್ ಈ ಡ್ರೈವರ್ಗಳಿಗೆ ಒಂದು ಸ್ಪೆಷಲಿ ಗೂಡ್ಸ್ ವೆಹಿಕಲ್ ಡ್ರೈವರ್ಸ್ ಅಥವಾ ನಾವು ಲಾರಿ ಡ್ರೈವರ್ಸ್ ಏನ್ ಹೇಳ್ತೀವಿ, ಅವರಿಗೆ ಎಕ್ಸ್ಟ್ರೀಮ್ ರೈಟಿಗೆ ಬಂದ್ರೆ ಅವ್ರಿಗೆ ಒಂಥರ ಸ್ಯಾಟಿಸ್ಫ್ಯಾಕ್ಷನ್, ವಿಚ್ ಈಸ್ ಮೆಂಟ್ ಫಾರ್ LMVs, ಫಾಸ್ಟ್ ಗೋಯಿಂಗ್ ವೆಹಿಕಲ್ಸ್. ತುಂಬಾ ಆಕ್ಸಿಡೆಂಟ್ಗಳಿಗೆ ನಮ್ಮದೊಂದು ಇಂಡಿಯನ್ ಸ್ಟೈಲ್ ಏನಿದೆ, ಇದು ರೈಟ್ ಸೈಡ್ ಡ್ರೈವಿಂಗ್. ಇವ್ರು ಎಕ್ಸ್ಟ್ರೀಮ್ ರೈಟಿಗೆ ಬಂದಾಗ ಲೆಫ್ಟ್ ಸೈಡ್ಗೆ ಅಂದ್ರೆ ಆ ಲಾರಿ ಇರ್ಬೋದು ಅಥವಾ ಮುಂದಿನ ವೆಹಿಕಲ್ ಇರ್ಬೋದು, ಲೆಫ್ಟಿಗೆ ಇವರು ಓವರ್ಟೇಕ್ ಮಾಡುವಾಗ ಮೇ ಬಿ ಅದು ಟ್ರಿಪಲ್ ವೇ ಇರ್ಬೋದು, 2 ವೇ ಇರ್ಬೋದು, ಏನೇ ಇರ್ಬೋದು, ತಗೊಳ್ಳುವಾಗ ಕ್ಲಾರಿಟಿ ಇರಲ್ಲ. ಅಂದ್ರೆ ಲೆಫ್ಟ್ ಪೂರ್ತಿ ರೋಡ್ ಖಾಲಿ ಇದೆಯೋ ಅಥವಾ ಬೇರೆ ವೆಹಿಕಲ್ ಇದೆಯೋ ಕ್ಲಾರಿಟಿ ಇರಲ್ಲ. ಸಡನ್ ಆಗಿ ತಗೊಂಡಾಗ ಅದು ಎದುರಿಗಿರುವಂತ ಗಾಡಿಗೆ ಹೋಗಿ ಇವ್ರು ಹೊಡ್ಕೊಳ್ಬಹುದು, ಅಥವಾ ಸಡನ್ ಆಗಿ ನಿಂತಿರ್ಬೋದು, ಬೇರೆ ಅಬ್ಸ್ಟಾಕಲ್ ಇರ್ಬೋದು, ಯಾರಿಗೂ ಗೊತ್ತಾಗಲ್ಲ. ಬಹಳ ಸಲ ಈ ಇಗ್ನೋರೆನ್ಸ್ ಮತ್ತೆ ಈ ತರದ ಒಂಥರ ದಾರ್ಷ್ಟ್ಯ ಇದೆ. ಯಾಕೆ ಇಡೀ ರೋಡೇ ನಂದು, ನಾನು ಯಾಕೆ ಹೋಗ್ಬಾರ್ದು ಅಲ್ಲಿ ಅನ್ನೋಂಥದ್ದು. ಎಷ್ಟೇ ಅವರಿಗೆ ಕಾಷನರಿ ಬೋರ್ಡ್ಸ್ ಅನ್ನ ಹಾಕಿ, ಎಷ್ಟೇ ಎಜುಕೇಶನ್ ಕೊಡಿ, ಏನೇ ಮಾಡಿ, ಅವರು ಫ್ರೀ ಇದೆಯಲ್ಲ ರೋಡ್, ನಾನು ಹೋಗ್ತಾ ಇದ್ದೀನಿ, ನನ್ನ ಯಾರು ಅಡ್ಡಿಪಡಿಸ್ತಾರೆ ಅಂತಕ್ಕಂಥ ಭಾವನೆ. ಇದನ್ನೆಲ್ಲ ನಾವು ಲೇನ್ ಡಿಸಿಪ್ಲಿನ್ ವೈಲೇಷನ್ ಅಂತೇಳಿ ಕೇಸ್ ಹಾಕೋದಕ್ಕೆ ನಾವು ಪ್ರಯತ್ನ ಮಾಡಿದಾಗ ಬಹಳ ಕಷ್ಟ ಆಗುತ್ತೆ. ಮೇ ಬಿ ಒಂದು ಲಾರಿಯನ್ನ ನಾವು ನಿಲ್ಲಿಸ್ತೀವಿ ಅಂದ್ರೆ ಇನ್ ಸಪೋರ್ಟ್ ಆಫ್ 1 ಲಾರಿ ಅನದರ್ 10-15 ಲಾರೀಸ್ ಹೈವೇ ಮೇಲೆ ನಿಂತಿರುತ್ತೆ. ನಮಗೆ ಯಾರಿಗೋ ಒಬ್ಬನಿಗೆ ದಂಡ ಹಾಕಿ ಅವನಿಂದ ದಂಡ ವಸೂಲಿ ಮಾಡಿ ಅವನಿಗೆ ಪನಿಷ್ಮೆಂಟ್ ಕೊಡೋದಕ್ಕಿಂತ ಹೈವೇ ಆಗ್ಬೋದು, ಟ್ರಾಫಿಕ್ ಕಂಜೆಷನ್ ಅನ್ನ ಫ್ರೀ ಮಾಡೋದು ನಮ್ಮ ಮೊದಲನೇ ಆದ್ಯತೆ. ಅದ್ರ ಆಚೆಗೆ ಬೇರೆ ಪೀನಲ್ ಪ್ರಾವಿಷನ್ಸ್ ಮತ್ತೊಂದು ಇನ್ನೊಂದು ನೋಡ್ಬೇಕಾಗುತ್ತೆ. ಈ ಕಾರಣಕ್ಕಾಗಿ ಇದು ಕೂಡ ನಾವು ಬಹಳ ಸಾರಿ ಫೇಲ್ಯೂರ್ ಆಗೋದಕ್ಕೆ ಕಾರಣ ಆಗುತ್ತೆ. ಇಂಥ ಸಂದರ್ಭಗಳಲ್ಲಿ ಆ ಡ್ರೈವರ್ಗಳು ಬಹಳ ವಿಚಿತ್ರವಾಗಿ ವರ್ತನೆಯನ್ನು ಮಾಡ್ತಾರೆ. ತುಂಬಾ ದಿನಗಳ ಕಾಲ ಅವರ ಫ್ಯಾಮಿಲಿಯಿಂದ ದೂರ ಇರ್ತಾರೆ. ಮೇ ಬಿ ಅವರು ನಮ್ಮ ತರನೇ ಮನುಷ್ಯರು, ಮೇ ಬಿ ಅವರಿಗೂ ಅವರದ್ದೇ ಆದ ಡಿಫಿಕಲ್ಟೀಸ್ ಇನ್ ಫ್ಯಾಮಿಲೀಸ್ ಇರ್ಬೋದು. ಮಕ್ಕಳ ಎಜುಕೇಶನ್ ಇರ್ಬೋದು, ಬಹಳ ಕಾಲ ಅವರ ಫ್ಯಾಮಿಲಿ ಜೊತೆ ದೂರ ಇರತಕ್ಕಂಥ ಡಿಸ್ಟ್ರೆಸ್ ಇರ್ಬೋದು, ಬೇರೆ ಬೇರೆ ತರನಾದ ಸಮಸ್ಯೆಗಳು ಕೂಡ ಅವರಿಗೆ ಕಾಡ್ತಾ ಇರ್ಬೋದು. ಅವರು ನಿಜವಾಗಿಯೂ ಕೂಡ ಎಂಟೈರ್ ಸೊಸೈಟಿಯನ್ನ ಬ್ಲೇಮ್ ಮಾಡೋ ತರನೇ ನೋಡ್ತಾರೆ. ಅಂಡ್ ಇಡೀ ಸೊಸೈಟಿ ಅವರಿಗೆ ಅಗೇನೆಸ್ಟ್ ನಿಂತಿದೆ ಅನ್ನೋ ತರ ಆಲೋಚನೆಯನ್ನ ಮಾಡ್ತಾರೆ. ಅಂಡ್ ಅವ್ರು ರೆಸ್ಪಾಂಡ್ ಮಾಡೋದು ಕೂಡ ಅದೇ ತರ ಮಾಡ್ತಾರೆ. ಅದನ್ನ ಮಿಟಿಗೇಟ್ ಮಾಡ್ಕೊಳ್ಬೇಕಾಗುತ್ತೆ. ಅದ್ರ ಜೊತೆಗೆ ಅವರಿಗೆ ನಾವು ಸೂಕ್ತ ತಿಳುವಳಿಕೆಯನ್ನು ಕೂಡ ನಾವು ಅವರಿಗೆ ಕೊಡ್ಬೇಕಾಗುತ್ತೆ. ಅದ್ರ ಜೊತೆಗೆ ಇನ್ನೊಂದು ಆಕ್ಸಿಡೆಂಟ್ಗೆ ಕಾರಣ ಆಗ್ತಕ್ಕಂಥದ್ದು ಮತ್ತೆ ಸ್ವಲ್ಪ ಈ ರೋಡ್ ರೇಜ್ಗಳಿಗೆ ಜಾಸ್ತಿ ಅಗ್ರೆಷನ್ ಅನ್ನು ಕೊಡ್ತಕ್ಕಂಥದ್ದು ಈ ನೇಟಿವಿಟಿ ಅಥವಾ ನಾವು ಟೆರಿಟರಿ ಅಂತ ಏನ್ ಕರಿತೀವಿ ಅದು. ಫಾರ್ ಎಕ್ಸಾಂಪಲ್, ಈಗ ನಾವೆಲ್ಲರೂ ಇಂಡಿಯನ್ಸ್, ನಮ್ಗೆಲ್ರಿಗೂ ಫ್ರೀ ಮೂವ್ಮೆಂಟ್ ಇದೆ, ನಾವೆಲ್ಲರೂ ಹೋಗ್ಬೋದು, ನಮ್ಗೇನ್ ಪಾಸ್ಪೋರ್ಟ್ ವೀಸಾ ಏನು ಬೇಕಾಗಿಲ್ಲ, ಆರಾಮಾಗಿ ಓಡಾಡ್ತೀವಿ. ಆದ್ರೆ ಕರ್ನಾಟಕದವರು ತಮಿಳ್ನಾಡವರು ಬಂದ ತಕ್ಷಣ ನಾನು ಕರ್ನಾಟಕದಲ್ಲಿದ್ರೆ ನನ್ನ ಸುಪ್ರೀಮಸಿ ಬರುತ್ತೆ, ತಮಿಳ್ನಾಡಲ್ಲಿ ಇದ್ರೆ ಅವನ್ ಸುಪ್ರೀಮಸಿ ಬರುತ್ತೆ. ಇದು ವೈಸ್ ವರ್ಸ ಎಲ್ಲ ಕಡೆಗೂ. ಅದೇ ತರ ಮೇ ಬಿ ನಮ್ಮೂರು ಪಕ್ಕದೂರು ಬಂದಾಗೂ ಕೂಡ ಅದು ಬಂದೇ ಬರುತ್ತೆ. ಅದನ್ನ ನಾವು ಗಮನಿಸ್ತೀವಿ. ಈ ತರ ಆದಾಗ ಯಾರು ನೇಟಿವ್ ಸುಪ್ರೀಮಸಿಯನ್ನ ಯಾರು ಸಾಧಿಸ್ತಾರೆ ಅದು ಕೂಡ ಈ ರೋಡ್ ರೇಜ್ಗಳಿಗೆ ಕಾರಣ ಆಗ್ತಕ್ಕಂಥ ಚಾನ್ಸಸ್ ಇದೆ. ಇಂಥದ್ದನ್ನೆಲ್ಲ ನಾವು ಓವರ್ಕಮ್ ಮಾಡುವಂಥದ್ದು ಮತ್ತೆ ಅದನ್ನ ಅಧ್ಯಯನ ಮಾಡ್ತಕ್ಕಂಥದ್ದು ಇದರ ಬಹಳ ಅಗತ್ಯ ಇದೆ. ಮೇ ಬಿ ಇದು ಅತ್ಯಂತ ಸೂಕ್ತವಾಗಿರ್ತಕ್ಕಂತಹ ಅಂಶ. ತುಂಬಾ ಸಾರಿ ನಾವು ನಾನು ಮೊದಲೇ ಹೇಳಿದ ಹಾಗೆ ಪೋಸ್ಟ್ ಆಕ್ಸಿಡೆಂಟ್ ಕಡೆಗೆ ನಾವು ಜಾಸ್ತಿ ಗಮನ ಹರಿಸ್ತೀವಿ. ಅಂಡ್ ರೆಮಿಡಿಯಲ್ ಆಕ್ಟಿವಿಟೀಸ್ ಆನ್ ರೋಡ್ಸ್ ಅದ್ರ ಕಡೆ ಗಮನ ಹರಿಸ್ತೀವಿ. ಅವೆಲ್ಲವೂ ಕೂಡ ಅಗತ್ಯನೇ, ನೋ ಡೌಟ್. ಗೋಲ್ಡನ್ ಆರ್ ಇದೆ, ಗುಡ್ ಸಮರಿಟನ್ಸ್ ಇದ್ದಾರೆ, ಎಲ್ಲರೂ ಇದ್ದಾರೆ. ಅದನ್ನೆಲ್ಲ ನಾವು ಒತ್ತಿ ಹೇಳಬೇಕಾಗಿದೆ, ಅದು ಅಗತ್ಯ ಕೂಡ ಇದೆ. ಎಟ್ ದ ಸೇಮ್ ಟೈಮ್ ಎಲ್ಲಿ ಸ್ಪೆಷಲಿ ಇದಕ್ಕೆ ಅಗತ್ಯವಾಗಿ ಬೇಕಾಗಿರುವಂತದ್ದು ಟಾರ್ಗೆಟೆಡ್ ಗ್ರೂಪ್ ಲೈಕ್ ಡ್ರೈವರ್ಸ್. ಈಗ ಯಾರು ಡ್ರೈವರ್ ಅಲ್ಲ ಅಂತ ಹೇಳೋ ಹಾಗಿಲ್ಲ. ಯಾಕೆಂತಂದ್ರೆ 72% ವೆಹಿಕಲ್ ಪಾಪ್ಯುಲೇಷನ್ ಇರೋದೇ ನಮ್ದು ಟೂ ವೀಲರ್. ದೇ ಆರ್ ಆಲ್ ಡ್ರೈವರ್ಸ್. ಅದೇ ತರ ನಾವು ಕಾರ್ ಡ್ರೈವ್ ಮಾಡೋರು ಇರ್ಬೋದು, ಬಸ್ ಡ್ರೈವ್ ಮಾಡೋರು ಇರ್ಬೋದು, ಎಲ್ಲರೂ ಕೂಡ ಡ್ರೈವರ್ಸ್. ಒನ್ ಆರ್ ಅದರ್ ರೀಸನ್ಸ್ ನಾವೆಲ್ಲರೂ ಕೂಡ ರೋಡ್ ಮೇಲೆ ಡ್ರೈವರ್ ಆಗಿ ಬಂದೇ ಬರ್ತೀವಿ. ನಮ್ಮ ಸೈಕಾಲಜಿಕಲ್ ಡಿಸಾರ್ಡರ್ ಇರ್ಬಹುದು, ಅಥವಾ ನಮ್ಮ ಮೆಂಟಲ್ ಪ್ರೆಷರ್ ಇರಬಹುದು, ಅಥವಾ ನಾವು ಬೇರೆ ನಮ್ಮ ಸೋಶಿಯೋ ಎಕನಾಮಿಕ್ ಕಂಡೀಷನ್ಸ್ ಇರಬಹುದು. ಇವೆಲ್ಲವೂ ಕೂಡ ನಮ್ಮ ಡ್ರೈವಿಂಗ್ ಅನ್ನ ಅಥವಾ ನಮ್ಮ ವರ್ತನೆಯನ್ನ, ಡ್ರೈವಿಂಗ್ ಅಲ್ಲಿ ನಮ್ಮ ವರ್ತನೆಯನ್ನ ಅವು ನಿಯಂತ್ರಿಸೋ ಕಾರಣಕ್ಕಾಗಿ ಇದು ಬಹಳ ಅಧ್ಯಯನ ಯೋಗ್ಯವೂ ಕೂಡ ಆಗಿದೆ. ಮತ್ತೆ ಅದಕ್ಕೊಂದು ನಾವು ರೆಮಿಡಿಯಲ್ ಮೆಷರ್ಸ್ ಅನ್ನ ಕೂಡ ನಾವು ಕಂಡುಕೊಳ್ಳಲೇಬೇಕಾಗಿದೆ. ಬಹಳ ಔಚಿತ್ಯಪೂರ್ಣವಾಗಿರ್ತಕ್ಕಂಥ ವಿಚಾರ. ಮೇ ಬಿ ಕೆಲವು ಮಾತನ್ನ ಮಾತಾಡೋದಕ್ಕೆ ಸಾಧ್ಯ ಆಗಿದೆ. ಐ ಥಿಂಕ್ ನಾನು ಕೂಡ ಇದರಲ್ಲಿ ಬಹಳ ಹಿಂದೆ ಇರತಕ್ಕಂಥವನು. ಥ್ಯಾಂಕ್ ಯು ಕಿಶೋರ್ ಸರ್ ಅಂಡ್ ಪ್ರಿನ್ಸಿಪಲ್ ಸರ್ ಅಂಡ್ ಎಂಟೈರ್ ಪ್ಲಾಟ್ಫಾರ್ಮ್ ಫಾರ್ ಅನ್ ಅಪಾರ್ಚುನಿಟಿ. ಥ್ಯಾಂಕ್ ಯು so much.
Thank you, sir. Thank you so much for sharing ground reality about traffic issues and road rage and road traffic accidents, and it gave us a lot of insight about it. Thank you so much for your valuable thoughts. So now let us move on to the participants' opinion. Let me invite Mr. Sandeep, who is a well-being officer.
Sir,
Yes, sir.
one minute, Kishore. Parashurama,
Yes, sir.
sorry, I would like to add one more point, because you are a senior most administrator. So whenever there is an accident, ಎಲ್ಲರೂ ಇದ್ದಾಗ ಜನ ಅವ್ರ ಕೇರ್ ಕೊಡೋದಾಗಲಿ, ಇಮಿಡಿಯೇಟಾಗಿ ಹಾಸ್ಪಿಟ್ಲಿಗೆ ಶಿಫ್ಟ್ ಆಗೋಗಲಿ ಹೆಸಿಟೇಟ್ ಮಾಡ್ತಾರೆ. ತುಂಬ ಕೆಲವರು ಸುಮ್ಮನೆ ಫೋಟೋ ತೊಗೊಳ್ಳೋದು, ಅದೇ ವೈಟಲ್ ಟೈಮ್ ಹೋಗ್ಬಿಟ್ರೆ ಪ್ರಾಣನೇ ಹೊಟ್ಟೋಗ್ಬಿಡುತ್ತೆ. ಅಂಥ ಪರಿಸ್ಥಿತಿಲಿ ಅವ್ರಿಗೆ ನಾವು ಕರ್ಕೊಂಡು ಹೋದ್ರೆ ನಮ್ಮನ್ನು ಅಲ್ಲಿ ಎಲ್ಲಿ ಕೇಸ್ ಅಂತ ಮಾಡ್ತಾರೋ, ನಮ್ಮನ್ನು ಅಲ್ಲಿ ಕ್ವಶನ್ಸ್ ಕೇಳ್ತಾರೆ, ನಮ್ಮನಿಗೆ ಟ್ರಬಲ್, ಸುಮ್ಮನೆ ಅನ್ನೆಸರಿ ನ್ಯೂಸೆನ್ಸ್ ಆಗುತ್ತೆ, ನಾವು ಕೋರ್ಟ್ಗೆ ಹೋಗ್ಬೇಕು ಅನ್ನೋ ಮೆಂಟ್ಯಾಲಿಟಿ ಪಬ್ಲಿಕ್ ಬಂದುಬಿಟ್ಟಿದೆ. ಅದನ್ನು ಹೋಗಿಸ್ಬಿಟ್ರೆ ಆ ಆಕ್ಸಿಡೆಂಟ್ ವಿಕ್ಟಿಮು ಬದುಕೋ ಚಾನ್ಸಸ್ ತುಂಬ ಚೆನ್ನಾಗಿರುತ್ತೆ. ಇಮಿಡಿಯೇಟಾಗಿ ಕರ್ಕೊಂಡು ಹೋಗ್ತಾರೆ. ಅದ್ರ ಬಗ್ಗೆ ತಾವು ತಿಳುವಳಿಕೆಯನ್ನು ಪಬ್ಲಿಕ್ಕಿಗೆ ಕೊಡಬೇಕು ಅಂತ ನಾನು ಈ ಮೂಲಕ ಕೇಳ್ಕೊಳ್ತೇನೆ.
ಸರ್, ಬಟ್ ಈಗ ಲಾ ಚೇಂಜ್ ಆಗಿದೆ ಅಲ್ಲ ಸರ್, ಲಾನಲ್ಲಿ ಆ್ಯಕ್ಚುಲಿ ಅವರು ದೇ ನಿಡ್ ನಾಟ್ ಹ್ಯಾವ್ ಟು ಕಮ್ ಟು ಕೋರ್ಟ್ ಅಂತ ಇದೆ ಅಲ್ಲ ಸರ್. ಸೊ ಅದನ್ನ ಹೆಚ್ಚು ಜನರಿಗೆ ಅವೇರ್ನೆಸ್
ಇರಲ್ಲ,
ಬಿಕಾಸ್ ದೇ ಆರ್ ಸ್ಕೇರ್ಡ್ ಆಫ್ ಗೋಯಿಂಗ್ ಟು ಕೋರ್ಟ್. ನಾನೇನು ಸಾಕ್ಷಿ ಹೇಳಬೇಕಾಗತ್ತೆ ಏನು ಅದೆಲ್ಲ ಇರುತ್ತೆ. ಸೊ ಇಫ್ ದಟ್ ಅವೇರ್ನೆಸ್ ಇಸ್ ಕ್ರಿಯೇಟೆಡ್ ದಟ್ ವಿಲ್ ಹೆಲ್ಪ್ ಅಂತ ಅನ್ಸುತ್ತೆ, ಬಿಕಾಸ್ ಲಾ ಇಸ್ ದೇರ್ ನೌ.
ಕರೆಕ್ಟ್, ಅದು ಅವೇರ್ನೆಸ್ ಇಲ್ಲ.
Yes, sir. You are rightly pointed out the thing, sir. Actually, I think ಬಹಳ ಹಿಂದೆ ಈ ತರ ಆಗಿರಬಹುದು ಸರ್. ಐ ಥಿಂಕ್ ಇತ್ತೀಚೆಗೆ ಗುಡ್ ಸಮರಿಟನ್ ಲಾ ಬಂದ್ಮೇಲೆ ಅಂಡ್ ಈಗ ಪೊಲೀಸ್ ಆಫೀಸರ್ಸ್ ಯಾರು ಕೂಡ ವಿಟ್ನೆಸ್ ಅನ್ನ ಅಲ್ಲಿ ಹುಡ್ಕೋದಕ್ ಹೋಗಲ್ಲ. ನಾವ್ ಯಾರು ಕೂಡ ಐ ಥಿಂಕ್ ಶಿಫ್ಟ್ ಮಾಡಿದವ್ರು ಯಾರು ಅವ್ರನ್ನ ಹುಡ್ಕಕ್ ಹೋಗಲ್ಲ. ಜನರಲಿ ಐ ವಿಟ್ನೆಸ್ ಗಳಿದ್ರೆ ಅದನ್ನ ನಾವು ಕ್ಯಾಚ್ ಮಾಡ್ಕೊಳ್ಳೋದಕ್ಕೆ ಅಥವಾ ಅವರನ್ನ ರೆಕಾರ್ಡ್ ಮಾಡ್ಕೊಳ್ಳೋದಕ್ಕೆ ಫಾರ್ ದ ಪರ್ಪಸ್ ಆಫ್ ಪ್ರಾಸಿಕ್ಯೂಷನ್ ದಟ್ಸ್ ಇಟ್ ಪ್ರಯತ್ನ ಮಾಡ್ತೀವಿ. ಯಾರು ಶಿಫ್ಟ್ ಮಾಡಿದ್ರು, ಯಾವ ವೆಹಿಕಲ್ ಶಿಫ್ಟ್ ಮಾಡಿದ್ರು, ಅವ್ರಿಗೇನ್ ಸಂಬಂಧ, ಈ ತರದ ಪೋಸ್ಟ್ ಮಾರ್ಟಮ್ ಇಂಟ್ರೋಗೇಷನ್ ಅನ್ನ ನಾವು ಆಕ್ಚುಲಿ ಮಾಡ್ತಾ ಇಲ್ಲ. ಅಂಡ್
ಬಟ್ ಜನಕ್ಕೆ ಇನ್ನು ಮಾಡ್ತೀರಿ ಅನ್ನೋ ಅಭಿಪ್ರಾಯ ಇದೆ.
ಫೋಬಿಯಾ ಜನರಲ್ ಇದೆ. ತುಂಬಾ ಸರಿ ನಮ್ಮ ಪೊಲೀಸ್ ಪಬ್ಲಿಕ್ ಕಾಂಟ್ಯಾಕ್ಟ್ ಪ್ರೋಗ್ರಾಮ್ ಗಳಲ್ಲಿ ಈ ತರದ ವಿಚಾರದ ಮೇಲೆ ನಾವು ಜಾಸ್ತಿ ಬೆಳಕು ಚೆಲ್ತೀವಿ. ಸ್ಟಿಲ್ ವಿ ಹ್ಯಾವ್ ಟು ಗೋ ಫಾರ್ ಲಾಂಗ್ ಆಕ್ಚುಲಿ.
ಎಜುಕೇಶನ್ ಮಾಡಬೇಕು ಪಬ್ಲಿಕ್. Thank you. Please go ahead, Pradeep.
Thank you so much, sir. Let me invite Mr. Sandeep, and who is a well-being officer at Mandya Police Department, and he also plays an active role in providing a psychosocial support to police personnel who are in distress, and who has joined this course on a primary care volunteers for psychiatric services, and successfully completed and attended all the classes that we have taken. Sandeep, I request you to please share your experience in this journey.
Namaste. Good evening, all. I am Sandeep, working as a well-being officer at Karnataka State Police. First of all, I would like thanks to JSS Medical College for providing this valuable learning opportunity. This course is not a simply course. This course is an eye-opener for everyone in the field of mental health. So I work with police personnel to improve their mental well-being, and this course has given me more knowledge and helped me to update myself actually. So every day we see different cases and different scenarios. So we look forward more such courses from JSS University. Especially thanks to Dr. Kishore sir and Pradeep sir for wonderful mentoring. Thank you.
Thank you, Sandeep. Thank you for inspiring words. We are also going to start this program in Kannada. We are looking forward more participants from a different sector. So now we are moving on to the special talk. I request Dr. Murali, Senior Resident, Department of Psychiatry, to speak about substance use and road traffic accidents. Murali?
Yes, sir.
Okay, Murali, you're audible.
Screen, sir. Is it visible, sir?
Screens are not. Yeah, it is visible. Yeah.
Yes. So, good evening, everyone. So I'm going to discuss one of the important topic, one of the crises that quietly claiming thousands of lives in our state, in our country every year. We usually see road traffic accident as an unfortunate instance of bad luck. But if we see or looking at the data from the traffic polices, the numbers coming out, if we see that, we can see the clear, undeniable pattern where we can see human errors, which is heavily influenced by substance use during driving, and these things turning our highways and city roads into the fatal zones. So in the next 5 minutes, we're going to look at the real-time data from 2025 and early 2026, and we'll understand the impact of driving under the influence of substances. So in the just first 10 months of last year, that is 2025, the state of Karnataka recorded 35,447 road accidents. From these incidents, we lost over 9,300 lives and another 44,000 people were injured. So to put that into perspective, nearly 30 families used to receive the worst news of their lives every single day. The highest number of deaths occurred in Bangalore and neighboring Tumkuru districts. In our state, we have the largest road network, but with that comes a heavy burden. So why these numbers are so high? The answer doesn't lie not only in the infrastructure, but also in the behavior behind the wheels. So coming to our city itself, Mysuru and our expressways, in the last first 10 months of 2025, Mysuru city itself saw nearly 1,000 accidents, resulting 171 deaths. This is only in the Mysuru city. If we include the entire Mysuru districts, it will increase up to 340 deaths or fatalities. So here we have to address the Bangalore-Mysuru Express. Of course, it cut down the travel time from Mysuru to Bangalore and Bangalore to Mysuru, but it has become the hotspot for the fatal crashes. High speed doesn't leave any room for the error, and because of the high speed, the chances of in the RTA that road of accidents are high in these express highways. So, what is causing this crisis? Why this total number of deaths, injured are coming? Medical professionals and traffic analysts, when they look into the data from the traffic police, the main cause for the majority of these accidents is the driving under the influence of alcohol and other recreational drugs. These alcohol and other recreational drugs, they impair the central nervous system. They act on our brain. They destroy drivers' motor skills, depth perception, reaction time, when to put the brake, where to take the cross. All these things will affect it because the person has taken alcohol or any other recreational drugs. Along with that, intoxication or using the substance like alcohol or any other drugs will create the false confidence in the people, and these people who has taken likely to speed more compared to normal person who has not taken the drugs. They fail to wear the seat belts and helmets and they way through the traffic, causing trouble to self and also to others. To understand the scale of substance use problem in our state or in our city, we have to look at the capital city first, that is Bangalore. In 2025, traffic police booked nearly 39,000 cases of drunk driving. If we compare it to the 2024, it is massive 62% increase is there from the previous year. Even with that, government has taken so many precautions like putting thousands of people challans, but still offenders are trying to avoid license suspension. So now the government is taking strict enforcing law, causing mandatory digital license suspensions after they get to know that just small fine is not enough to stop these accidents. So now it is also important to understand driving under the influence is no longer only about the alcohol. Nowadays, many other drugs are coming into the pictures like marijuana, cannabis, MDMA, and because the person well taking these drugs doesn't the same effect will happen as in the alcohol. The traffic police can detect the alcohol person is taking alcohol with the breath analyzer, but identifying a person who has taken the synthetic drugs, cannabis, marijuana, our traffic police officers are not equipped with any of the tests to identify these drugs. So to conclude, the statistics from 2025 and 2026 are not just numbers on a screen. The 9,000 lives lost in Karnataka last year were parents, children, and friends. Road traffic accidents fueled by substance use are entirely preventable. It requires government to act with firmer hands on our highways, but more importantly, it requires a cultural shift from us. We must normalize taking a cab, handing over the keys, and stopping our friends from driving impaired or under influence. Let us treat driving as the immense responsibility that it is. Together, by making smarter choices, we can make the roads of Mysuru, Bangalore, and all of Karnataka safe. Thank you.
Thank you, Dr. Murali, for a highly informative and thought-provoking presentation. So let us move to the special talk two. I invite Dr. Akshata CJ, Senior in the Department of Psychiatry, JSS Medical College and Hospital, to deliver a special talk on road rage and mental health. Dr. Akshata, over to you.
Thank you, sir. Seeking the blessings of His Holiness, respected dignitaries, faculties, and students. I'm Dr. Akshata, consultant psychiatrist in JSS Medical College. I'll be talking about road rage. Firstly, what is road rage? Imagine you are driving a car and suddenly their vehicle cuts you off. Or in some instances, somebody in front of you going very slow, not giving space for you to drive. Or it may be like somebody constantly honking you behind your vehicle. So how do we feel in these situations? Sometimes we feel annoyed, sometimes we feel frustrated, sometimes we ignore. But in some cases, they may become angry, they may get into fights. It can be heated arguments, it can be getting into fights, and sometimes we do have heard stories like taking out their weapons and killing people. It is not rare anymore. There have been many deaths because of road rage in various parts of the country, and also it's very common globally as well. So all these constitute road rage. So it is aggressive behavior of driver towards the other people on road. That is road rage. Now, moving on, what are the causes for road rage? Many of the guests and dignitaries address this issue. There was an interesting study involved in road rage. They were actually getting late. So this is one important factor. So those who are getting late, those who are in hurry, they drive fast, they'll be frustrated, they are under stress, and they tend to get frustrated and get into fights very easily. This is one of the reasons not being on time or being late. Secondly, stress. Sometimes people would have driven for very long distance without taking breaks. They would have dehydrated. This is another reason. Or sometimes personal issues or any other stress at work be the causes. If we are not in right state of mind, definitely we will be easy to get angry. This is another reason. And what actually happens in our brain when we are witnessing road rage? Imagine you are driving a car and suddenly somebody comes very close to you in their vehicle. You are about to hit them. So how do you feel? You feel fearful, right? So in these situations, what actually happens is this is a dangerous situation. Signals goes to our brain immediately. Initially, signals reaches our brainstem, which is in the lower part of the brain. So from there, it reaches emotional centers. After that, it reaches our forebrain, which is in the front part of the skull. The forebrain is responsible for rational thinking, judgment. So in such instances, what actually happens, our brain tries to react immediately. When the signals reach the brain stem and emotional centers, we try to react. So we feel emotions first before thinking. That's why many times we show our frustration, anger easily without thinking. If we wait for some time, maybe for 6 seconds, they say, it will reach our forebrain. Then we actually think clearly. That's why they say, if you buy some time, maybe few seconds, 5 to 10 seconds also, you are able to think clearly. Your brain works rationally. That is another reason, like explaining what happens in brain during road rage. Another thing is heightened state. Imagine when you are driving, your mind will be in alert state. You have to be very focused. You have to be energetic. So in such instances, if somebody really comes close to you or get into fights, your energy channelized towards frustration, towards anger. That's the reason people tend to shout very loudly, get into fights easily. That's because of heightened state which happens during driving. And one more reason would be personality. Many individuals have anger issues. So it is very easy for them to get into fights, and it's very common for them to get angry even for trivial issues. So even personality plays role in road rage issues. And one more thing is having unrealistic attitude. This was also told by sir previously. We have to understand we live in society. We can't expect everyone to have our views. For example, if somebody cuts you off, if somebody going slow, we think that is wrong. That shouldn't be the case. But practically, if you think that's all possible, people are different. We have to have realistic. We have to have flexible mindset. That's another thing. Having unrealistic views. It should be I am driving in front. Why did the person cut me off? Or why is he going slow on this lane? Having very rigid views also leads to road rage. These are all the causes for road rage incidences on road. Moving on, how can we tackle this problem? We know that it's leading to a lot of problem, from mental trauma to fights to deaths also. So first thing, as I said, working on a schedule. You have to plan your schedule, leave early. so that you will not be in hurry, you will not be getting late, and that will avoid stress to the greater extent. You will be driving very calmly. That's one other thing. Second thing, if you are getting stressed, if you are driving for long distance, take breaks in between. Have water, hydrate properly. You can listen to music that will also have some calming effect. One more important thing is communication. This is very important. For example, if you are driving and you can actually make hand gestures, you can actually give signals that you want to go first or asking them to wait. These simple gestures actually avoid misunderstandings to the greater extent. That will also avoid having ego issues. You will understand, okay, he's communicating that maybe he's in urgency. It is very important to have communication. This will reduce road rage incidents to the greater extent. And then what do we do when we are actually in that scene? When somebody is provoking us, somebody is trying to get into fights with that. In such instances, either you can buy some time and analyze what's happening. As I said, if you take some time, we can think rationally. What is the solution for this? Second thing, avoiding such incidents. So getting involved and ruining our day is very bad. Just remember, reaching home safely is always better than ruining our day or killing ourselves. So if we remember this, most of the time we can handle such situations very easily. Also, in some cases, if somebody is chasing us, definitely we can take help of police. In proper way, we can handle that. Many times, if we ignore, if we avoid that, getting into such incidences, problems will be solved. That's another thing. And one more thing is, and lastly, very important thing is awareness programs. We should have more and more awareness programs about this topic. What is road rage? What happens in road rage? Like people might think that it is something they are seeing, but they don't really give it a thought about it. What can happen in road rage? How can it ruin someone's life? How some small misunderstanding can take out someone's life? We have to make them understand. And how do we tackle? What could be the practical strategies that people can employ while driving? This will avoid road rage to the greater extent. At the end, I think it is not just one department or one sector's responsibility. It should be collective responsibility of public, police personnel, mental health personnel, and also government NGOs to have more such programs and to have responsibility towards each other so that we can prevent road rage to a greater extent. Thank you.
Thank you, Dr. Akshata, for shedding a light on the vital link between the mental health and road behavior. Your talk has given us so much to reflect on. Thank you so much. So let us move to the last stage of the program. So vote of thanks. So let me extend a heartfelt vote of thanks on the behalf of the Department of Psychiatry. And we first thank sincerely to Shri Parashurama Kesar, IPS, and Basavanagoda, Dr. H. Basavanagoda sir, Vice Chancellor, JSS AHER, and Dr. B. Manjunatha sir, Registrar, JSS AHER, and Dr. Madhu CP sir, Director, JSS Medical College and Hospital, Dr. Narayana sir, Principal, JSS Medical College, and Dr. Suma Madam, and Mantapa sir, and Dr. Kishore sir. And along with this, I also thank Dr. Murli and Dr. Akshata for outstanding and special talk, and also the participants who have successfully completed the course on the value-added course on primary care volunteers for psychiatric services, and also the students from the Department of Psychiatry, postgraduate students from the Department of Psychiatry, and especially the JSS Medical College technical staff who have given us a lot of help in terms of conducting technical support in terms of conducting this event online. Thank you so much. Thank you, one and all.
Thank you. Thank you, Parashurama sir. Thank you.
Thank you, sir. Thank you. Thank you so much, sir.
So, come to the college, sir, sometime.
Sure, sir. Yes, sir. Thank you, sir. Thank you. Yes, sir.
Thank you,
Mysuru
Akshata,
ಬಂದಾಗ ದಯವಿಟ್ಟು ಹೇಳಿ,
Murli.
sir.
Did well.
Thank you, sir.
Thank you,
Thank
sir.
you, thank you, sir. Thank you.
Thank you, one and all.
Thank you, Pradeep. Thank you so much.
Thank you so much.